Welcome to today's Essential Health Guide for Seniors. If you're over 70 or you love someone who is, this video could quite literally save a life. Because after 70, your body is no longer whispering to you, it's sending clear signals. The problem? Most people ignore them, or worse, rely on outdated advice. But today, a seasoned doctor explains exactly which 3 medical tests you must do after 70 to stay alive, independent, and thriving. These are not optional. These are not just helpful. These tests are life-saving. And we're also going to explain why many seniors skip these tests and what it costs them, what warning signs to watch for, how to request these tests from your doctor without feeling awkward, and what the results really mean. Stick around to the end, because it's not just about testing, it's about prevention, empowerment, and aging with confidence. Let's dive in. Section 1. Why testing after 70 matters more than evening 70 is a milestone, but it's also a turning point. At this age, your body begins to slow down in ways you don't always notice until it's too late. But here's the good news. Many age-related illnesses can be caught early and managed if you know where to look. So, why do so many seniors avoid testing? 1. Fear of bad news. Some people say, if I don't know, I don't have to worry. But in medicine, ignorance is not bliss. It's risk. Catching something at stage 1 is far better than at stage 4. 2. Overconfidence from feeling fine. Just because you feel okay doesn't mean everything is okay. Some conditions like high blood pressure, prostate issues, or osteoporosis can be silent for years before showing symptoms. 3. Lack of clear advice. Many seniors complain their doctor never tells them what to check. That's why this video is so important. We're breaking down the 3 essential tests, explaining why they matter, how often you need them, and what to expect. Ready? Let's start with the most urgent one. Section 2. Test number 1, colon cancer screening, colonoscopy, or FIT test. Why it matters. Colon cancer is one of the most preventable yet deadly cancers if caught too late. After 70, the risk increases, especially if you've never had a colonoscopy or are overdue. Facts you should know. 1 in 23 men and 1 in 25 women will develop colorectal cancer in their lifetime. Most colon cancers begin as benign polyps. These can be removed during screening before they become cancerous. Signs you might have an issue, even if you feel fine. Blood in the stool. Unexplained weight loss. Changes in bowel habits.
Constant fatigue.
What test to get? Colonoscopy every 10 years if results are normal. Or FIT test, fecal immunochemical test, annually, especially if you can't undergo a colonoscopy. The FIT test is a stool test you do at home. It's non-invasive, fast, and cheap. How the colonoscopy works. Sedation is used. Most people feel nothing. It takes 30 to 60 minutes. The doctor uses a tiny camera to examine the colon and remove any polyps during the same procedure. When to start or stop. If you've never had a colonoscopy and are in good health, even at 75, it's not too late. If you're over 85 or have serious health issues, discuss with your doctor if continued screening makes sense. Section 3. Test number 2, bone density test. DEXA scan. Osteoporosis is known as the silent bone thief. You won't feel it coming. But once you fall and break a hip, recovery is tough, and many never walk again. After 70, your bone loss accelerates dramatically, especially in women. Startling statistics. 1 in 3 women over 70 has osteoporosis. 1 in 5 men over 70 will suffer a fracture from low bone density. Hip fractures increase the risk of death within 12 months by up to 30%. What the DEXA scan shows. Bone mineral density, BMD, scores. Risk of fracture in the next 10 years. Areas of most bone loss, spine, hips. What it feels like. A DEXA scan is painless. You lie on a table fully clothed. A machine passes over your body for 10 to 15 minutes. How often to get it? Once every 2 to 3 years after 70. Earlier if you've lost height, had a fracture, or take steroids. What you can do if your score is low. Vitamin D and calcium supplements. Weight-bearing exercise. Medications like bisphosphonates if needed. Reduce fall risk at home. remove rugs, install handrails. Section 4. Test number 3. Aneurysm or carotid artery ultrasound. Aneurysms and narrowed arteries can burst or block blood flow without warning. They are often symptomless until a stroke or sudden death occurs. The risk increases significantly after 70, especially for men, smokers, even past smokers, and those with high blood pressure. What's being checked? AAA, abdominal aortic aneurysm, a bulge in the main artery that can rupture. Carotid artery stenosis, narrowing of neck arteries that supply the brain, can lead to strokes. What the ultrasound is like. It's non-invasive and takes 10 to 30 minutes. Similar to a pregnancy ultrasound, a gel is applied and a probe glides over your neck or abdomen. Who should get it? Men over 70 who've ever smoked. Women with family history of aneurysm. Anyone with high blood pressure, high cholesterol, or diabetes. Warning signs, often too late. Sudden weakness or drooping in the face. Vision problems. Pain in abdomen or back. Dizziness or fainting. What happens if they find something? Small aneurysms are monitored every 6 to 12 months. Larger ones may require surgery. Medications can manage blood pressure to reduce rupture risk. Section 5. Bonus. Other important tests to ask for. While we focused on the top 3, here are 3 bonus tests every person over 70 should discuss with their doctor. 1. Hearing test. Hearing loss affects memory, balance, and mood. Get screened every 1 to 2 years. Untreated hearing loss is linked to dementia risk. 2. Vision exam, including glaucoma screening. Vision changes sneak up on you. Glaucoma and macular degeneration are common over 70. Yearly checks are a must. 3. Annual blood tests. A simple blood test can reveal anemia, vitamin B12 deficiency, kidney or liver issues, thyroid problems, blood sugar levels, diabetes. Section 6. How to talk to your doctor without feeling ignored. Many seniors feel brushed off at the clinic. Here's how to advocate for your own health. Write down your questions before the appointment. Ask directly. Should I be tested for colon cancer, bone loss, or aneurysm risk? Bring a loved one to help you remember advice. If you're dismissed, say, I'd like this documented in my chart. That often changes the conversation. Conclusion. Don't wait for a crisis. Here's the truth. Most medical emergencies after 70 were preventable. Silent issues like colon polyps, fragile bones, or narrowed arteries don't make noise until it's too late. But you don't have to be a statistic. By doing these 3 tests, you're catching disease before it strikes. You're protecting your independence. You're giving your family peace of mind. Stethoscope colon cancer screening bone density, DEXA, aneurysm/carotid ultrasound. Don't wait. Schedule these with your doctor this month. You've worked hard your whole life. You deserve to live your golden years in strength, clarity, and confidence. Backhanded explaining right. If this video helped you, please like, subscribe, and share it with someone over 70. It could save their life. Comment below. Which test surprised you the most? Or have you had any of them done already? See you in the next health guide. And remember, growing older is inevitable, but aging poorly is optional.